Why do we emphasize chronic care? Why is that the most important thing? 84% of all healthcare spending is about chronic care. It's not about the acute broken bone or the trauma after a car accident. It's about care for people with chronic illness. And the big ones are, as you mentioned, diabetes, heart disease, COPD or emphysema, hypertension, asthma, cancer. Those are the big diseases. And if we can really solve the management of those diseases, then we can do a lot better. So take diabetes. Why is it so expensive? Well, the first thing is patients need to constantly attend to their diet, exercise, their insulin use, and then any complication that happens. So what are the best places doing? Well, they're working with patients to make sure that they've got their glucose in their blood well controlled so that they don't go too high or too low. Very, very important, but it takes a lot of attention because I don't know how many of you are on a chronic medication, but it's hard to do something every day and really, you often don't want to do it and you want to rebel. In addition, we know that exercise is super important for these patients, that it helps keep their blood sugar down, especially if they have type 2, that many of them can get off their medications if they exercise regularly. But transforming, putting exercise into your daily routine, all of us know it's hard. How do we know? Well, most of us don't adhere to our New Year's resolutions to do good things because it's hard to change our habits. Working with them to change habits. Then if they have a complication, say they get a cut on their toe, circulation's bad, it gets infected, it progresses to gangrene because they're not taking care of it, then maybe an amputation. All of those are huge costs. Well, the best places have a nurse or a doctor or someone taking really good care of that so it doesn't progress to infection, gangrene, and amputation. All of those, again, saves money. It's a healthcare system. We're keeping you healthy. We're not just attending to you when you're sick. So that's the kind of transformations we need to see in the system. Similarly, if we did it for patients with emphysema, getting them to take their medications, their breathing treatments, if they have an exacerbation so that they otherwise would be admitted to the hospital, now treating them at home. That turns out to be, in places that have done those experiments, they get better quality because they adhere to the guidelines. You send a nurse out twice a day. They actually recover faster. They're in their own house. Most of us who've spent any time in the hospital know that's the worst place in the world if you're sick and need to recover fast, right? You don't want to be in a hospital being woken up at 2 in the morning, 4 in the morning, 6 in the morning. And they actually, it turns out that care at home for these patients, 20% cheaper. So it's a win-win, better quality, lower cost. Getting the system to be able to do that regularly is where we've got to be headed.